All right, let's talk about them lady parts. Talking about the female reproductive anatomy, and I'm going to actually give you two views of this one. So we'll kind of just boom. There we go. Got a kind of weird lumpy butt. Actually, let me. Actually, I need to make my. I'm missing some parts here, actually. There we go. That's maybe a little small, but that's okay. Whoops. It ain't going to be perfect. Okay. Boom. Lady's got 3 holes. Dude's only got 2. 1, 2. 1, 2, 3. All right. And this first hole here is going to attach to the urethra and then up to the bladder. So remember, right there, we got a very short urethra. All right. And let's try we'll continue this on. So here, got the vagina, like so. And attached to that, we've got the uterus, which is actually where the embryo develops. Like so. Beautiful. Pretty happy with that, actually. Okay, and we're drawing a side view here, of course. All right, so this is the uterus. Uterus. Right here. Get out of here, fly. Okay, this little specialized structure. I didn't quite draw this quite right. Let me get rid of these. They need to be a little bit more like that. Okay. So this structure right here is the cervix. It's the closing. So this is the cervix. It's a tiny little hole between the vagina and the uterus. So this is the vagina. And this little part right here that's kind of up on the side, that's called the fornix. Okay. And this whole structure is the cervix, and that's like the cervical opening. So when you're talking about like pregnancy, it's like, how many centimeters are you dilated? They're talking about like how open is your cervix. 10 centimeters, like my finger right there, that's about 2.5 centimeters. So 10 centimeters is like 4 of those. It's like 4 of my pinkies. That's pretty big. It's like that big or something. Like, whoa, that cervix is about to pop. Okay. All right, then coming up off the top of this, we've got our ovary. And we're going to draw another view of this. So we got like a little ligament. And then we got kind of like an egg or oval shaped little contraption. And then we've got our oviduct, or our fallopian tube. Comes out of here. And it kind of reaches around, but doesn't actually fully touch the ovary. It's not fully sealed. And it's got these like little finger things called like fimbriae attached to it. So this is your ovary, and this is where the eggs are made, ovary. And this is your oviduct or fallopian tube, oviduct or fallopian tube. I think it's with a PH, actually. No, it's an A. Fallopian tube. Oviduct. Oviduct. Like that. Okay. And that's actually where pregnancy usually, or fertilization usually occurs. You don't want pregnancy there, but fertilization. We'll talk about that. This is usually site of fertilization. We'll go through that whole little process here in a minute. All right. And vagina, and then this little hole in the back here. Kind of far back, but that's okay. This is going to be our anus again. Gonna have some muscle around this bad boy. And then this is going to be our rectum. Not going to draw the whole thing, but that would be part of your large intestines. So this would be your rectum. And that's be the anus. Okay, we're still missing a couple parts here. I gotta draw them in. Okay. God damn, I got like these little soil flies from all my plants. I gotta figure out a mechanism to get rid of these bad boys. Okay. Boom, 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 boom. Boom, boom. Okay, on the outside, we got some structures. We got some skin folds here. Kind of protect this business. Okay. And we got a little special guy right about there. Okay. All right, so this is your labia minora. Labia minora. Small labia. And this is your labia majora. And these help protect the vagina, the vaginal opening, and the urethra. So this would be the urethra. Urethra. Okay. This right here. Do a little pointer in gray. And then I'll do the word in pink. This is your clitoris, which is the same as the head of the penis. This boy, very sensitive. Important for arousal. Okay. So it's got a nerve that kind of wraps. I'm not going to draw the whole thing, but kind of wraps back around like so. Okay. It's really, it's part of the vagina in some way. Just like the vagina is kind of like the shaft of the penis, and the clitoris is like the head of the penis, if you want to think about it that way. And a few inches up, on the anterior side, like 2 or 3 inches up the vagina, there's a little wavy patch. Like so. And this is a sensitive spot. It's actually controversial, medically, I guess. It's medically controversial as to whether or not this exists. But I'm pretty confident it exists. Maybe not in all women. This is the G-spot. Very sensitive area. Also for arousal. Okay. A couple inches up. Anterior side. Front side. the G-spot. Okay, and all of that arousal is important for lubricating the vagina. There's also a couple of glands here that help secrete lubricants. So during arousal, move this urethra. I'll kind of put it here in pink. During arousal, the vagina will secrete lubricants, like mucousy-like fluid substances, lubricants, to lubricate itself for intercourse. All right, so that's a nice little side view. Couple of pro tips here. You already kind of talked about the shortness of the urethra. All right, let's draw the front view of this. I think I got everything I wanted to cover there. Let's draw a front view of this. We're just going to draw just the vagina and the uterus from a side view here. All right, colors, purple and pink. Perfect. Okay, so vagina. Something like this. This is the vaginal wall of one side. Maybe not quite so thick. Vaginal wall of another. Okay, and now we got cervix. We want to draw in. I don't like the way that looks. It's kind of lopsided. You know, I don't need this to be perfect, but I want it to be perfect. Okay, that looks better. Okay, that's better. I'm okay with that. You know, biology's not perfect. Okay, so this is kind of the beginning of the uterus now. Okay. That looks pretty good. All right. Not quite happy. Sorry. There we go. I like that. All right, let me finish kind of the overall here. Want this to come up and over, something like that. Something like that. And then this is going to come up. Beautiful. Beautiful. Okay, and up at the top here, we've got part that kind of comes down like so. And then we got this that's going to go across. Beautiful. It's not perfect, but it's okay. Maybe a little fat. But biology's not perfect. I want to get rid of that. I need to fix that. Okay. Okay, that's better. All right, that looks pretty good. I'm okay with that. All right, so this is the vagina right here. It's the vagina. This is the uterus. All right, this would be the cervix right here, and the fornix. These lines actually would be like this a little bit. Like that. The cervix kind of comes down a little bit into the vagina. And then this would be the fornix here. This whole thing is the cervix. And there's actually like a little mucus plug in there. Like right here. Usually. Okay. To prevent anything from getting up into the uterus. Okay, and it especially plugs up when fertilization occurs. And then the baby is implanted into the uterine wall. All right, now let's draw in our ovaries. Our ovaries look like little eggy boos. And they're attached to the uterus with a little ligament. Okay. And we got our little like fimbriae kind of on this. They're not really attached here. Like an egg, we'll talk about that. We'll talk about egg production and all that. Okay, but we'll save that for the next video. All right, so this would be ovary. And this would be oviduct. Oviduct slash fallopian tube. And this is a little ligament that attaches. This is a little ligament that attaches to the ovary to kind of hold it into place. All right. Boom. All right, I think that's really all I want to do for female anatomy. In the next one, we're going to talk about the egg development and ovulation and the menstrual cycle. All right, I'll see you guys in the next one.